Hi, everyone. Thank you so much for tuning in week after week to the Greeners podcast. My name is Amie.
And my name is Sarah.
And we are your podcast hosts for today. So we are going to talk about such a hot topic, such a topic that means so much to Canadians. And we also think this is going to be such a boss podcast episode because we have not only just another nurse here, but a nurse who's also an influential politician. So before I take it away, I will pass the mic over to Sarah to introduce our guest for today.
I am absolutely in awe of our guest today. We have today someone really special, the Honourable Kamal Khera, who was first elected as Member of Parliament for Brampton West in 2015. Minister Khera is one of the youngest women ever elected to Parliament. As a registered nurse, community volunteer, and political advocate, she is passionate about improving the lives of those around her. Thank you so much for joining us today.
Thank you so much for having me. And can I just say I was fangirling a little bit about you guys because I think you guys are such rock stars and how you guys truly use this platform to amplify the voices of nurses, but not just nurses, but talk about issues that really matter in our communities on health and healthcare. So I just want to say thank you so much for having me on your podcast and really looking forward to this, I hope, a really fun conversation.
Absolutely. Fun and definitely illuminating because I think that there are a lot of questions about the topics that we'll be talking about today. So Sarah, take it away.
Absolutely. And I think we have a lot in common. So we're equally fangirling you today. This is going to be a fun episode. So for those of you that don't know Kamal, maybe you could tell us a little bit about your current role and what it is that you do.
Absolutely. So I am a proud member of parliament for a beautiful riding called Brampton West. And I've been a member of parliament for the last 7.5 years. I got elected back in 2015. And I am also a federal minister of seniors in Canada. So I get to work alongside incredible people and get to do what I do best, which is meet seniors in communities all over Canada, talk about issues that matter to seniors. And of course, issues related to our older adults and healthcare and everything in between that I know we all also care about when it comes to, of course, our nurses. So I'm very passionate about healthcare, very passionate about, supporting our communities in ways that I think we all do. And so I get to do what I love. And really, again, good to be here with you to talk about these things.
Yeah, we're like we said, we're in awe. We want to know more. We always talk about like nursing is political, nursing and politics. And a lot of folks don't even know that, as a nurse, you can get into these various different types of roles. So again, we know that you're a nurse. Could you tell us a little bit about your background in nursing, maybe even why you became a nurse, and really how has your pathway kind of led down to this role that you're in now? Because that's the conversation. We really want to know about that.
Absolutely. Well, I think first thing I want to say is I remember as a nursing student even, and I spent a lot of time talking to, going to different, universities and colleges and talk to young nursing students when they think about, what their careers could look like, right? Because reality is nurses are everywhere. Like nurses are, we're in public health, we're in proactive health, we're by the bedside, we're in acute care, we're in research development, and we're politicians. I mean, I remember the very first things that we're taught as nurses, is to be an advocate. And, we are the biggest advocates for our clients, our patients. And I don't think my role now is any different than it was before, because now I just get to advocate for a larger group of people, which is Canadians. And in my role as, of course, Canada's Minister of Seniors, it is about our older Canadians. But I was very young when I got into politics, not so young anymore. But so I graduated from York University. That's where I did my nursing. And then I worked at St. Joe's Hospital in Toronto in an oncology department, which is oncology, palliative, but you know how things are. Like it also turns into an acute medical unit as well. That's just the reality of our healthcare and within our hospitals. But I've also been really passionate about doing things in our community. So I was involved, and I loved politics. I loved to see how we can make difference in our community. And so I was part of the Young Liberals Club at York University and just got involved there. And back in 2015, I remember there was, immense, issues within my community, when you talk about healthcare, but when you talk about affordability, when you talk about climate change, like these are things that I was very passionate about in my community. And I felt that our voices weren't heard, to be honest. And so I didn't know how it was going to go, but I put my hand up. Within the process of how things work, I put my hand up to be a candidate, the Liberal candidate in 2015. And I can tell you, a lot of people were like, what is this 25-year-old nurse going to do? Like, I mean, dude, did you just start your career? Like, maybe you should,
Right.
spend some time. And I think one thing I learned really early on is we're advocates from the day we're born, particularly as women. I always say, like, we have the loudest voices and things that we care about people hear. And I just put everything aside and really worked hard and talked to a lot of people in my community, lots of door knocking, and who doesn't like being an underdog?
Right.
Hard work
Yeah.
paid off, and I became a good people of Brampton West gave me the best job ever, which is to be a member of parliament of this beautiful community of Brampton West. So that's how I got involved in politics. And it was really neat because one of the very first opportunities that I was appointed was also becoming a parliamentary secretary to the Minister of Health,
Wow.
which was very neat for me because if I can be candid, I didn't even know how the system really worked. And you learn a lot, when you first get elected. But it was really neat to be able to talk about things that I think we all care about. And we put in a lot of funding for mental health at the time. Medical assistant in dying was a very hot issue that we had to deal with, to having that voice and working in oncology and palliative care. I think I really brought that forward in shaping that policy. So these are things that I remember I got to work on very early on. And I mean, now I've been elected now for the last 3 years, not for the last 3 terms, and get to do some really exciting things. Served as parliamentary secretary to the Minister of International Development, and a lot of work even on that front because we have a feminist international assistance policy. We do a lot of work, on sexual reproductive health rights, not just in Canada, but around the world. So get to work on shaping that policy internationally. And of course, working of course, appointed as parliamentary secretary previously as for the Minister of National Revenue. So got to learn how all the finances work and how all that correlates with all the public policy when it comes to our healthcare gets put front at the center. So it's been a learning experience for sure. I learn every single day, as I'm sure you guys would agree. I think as nurses, we never stop learning. And it's what makes us, I think, one of the best advocates in the world.
That's amazing. Like, I think you just embody so many of the characteristics that we love about nurses. Like, I love how you say that all nurses are advocates, which is completely true. It's something that we can use in very many different aspects of our lives. The fact that you are a champion for seniors, the fact that you are doing so many great things, the intersection of healthcare and politics is so important. We're always seeing that. I know that, of course, the topic of seniors came up a lot during the pandemic, especially some of the conditions in long-term care. My grandmother was actually in long-term care and passed away from COVID during the pandemic. So obviously this is very near and dear to my heart. And I'm just wondering right now, what do you see are some of the top priorities for seniors in your role?
Absolutely. And thank you for sharing that perspective. And I think as nurses, we always knew the realities and tragedies that existed in the long-term care homes way before the pandemic, right? And it's actually very unfortunate that it took this pandemic for Canadians to realize what that's like. And, I remember back in March 2020 when the pandemic first hit during the first wave. And I remember RNO had put out a call for action to say, retired nurses or nurses that are not practicing to put your hand up and get back into we need volunteers. And I put my hand up. And I had the opportunity to put my scrubs back on and help out and volunteer at one of the hardest hit long-term care homes in Ontario. If you would recall, there were 4 in Ontario that the Canadian Armed Forces was called upon to help. And it was one of them that I was working alongside with some incredible nurses, but very, very challenging situations, right? I mean, we've all seen those realities and tragedies. And when you talk about nurses and the resiliency of nurses, I remember I was working with this RPN called Heather. Heather, she's been a nurse forever. She didn't go home for 2 weeks, and she stayed in a long-term care homes because she there was just not enough people, right? Like I remember this was a resident that half of the residents had tested positive, half of the staff had tested positive, and half of them didn't show up because they didn't know. Like this is such, super early on. And I can tell you those realities and those experiences is now, as a minister of seniors, I carry those experiences with me every day. So I remember back then, even, one of the things that we did was sent in boots on the ground for the federal government, whether it was Canadian Armed Forces or Red Cross, throughout the country where it was needed. We then made sure, we put aside $1 billion safe long-term care fund so that provinces can have those tools in place to be able to get that support as quickly as possible. But one of the things that I'm very proud of, and the thing is, a lot of people don't realize the fact that in the Canada Health Act at the federal level, we don't really have jurisdictions over long-term care homes, right? It's under the provincial governments. But we had to make sure those standards of care are up to the par of what that needs to be, right? So one of the things that we did at this time was gave money to two associations, which is Health Standards Organization and the Canadian Standards Association, which worked at least for 2 years to come up with the standards, the long-term care standards that were just released this January. And I truly believe these standards reflect what Canadians want, because they did so much consultation talking to seniors themselves, healthcare workers, caregivers and others to be able to come up with these standards. So now we have these national standards, which I'm really, really excited about. And the fact that we also have $3 billion that we put aside so that these standards can now be applied. So we're working with provinces and territories right now to make sure that work is ongoing, because regardless of where seniors live, we need to make sure we do a better job of supporting them. And I think those tragedies, sometimes I sometimes think that people have short-term memories. And I think part of my job is making sure that we're constantly reminding Canadians of what that was like, and including sometimes the provincial governments, if I can be candid, with the two of you. And so now that money's there to make sure those standards can be applied so that we never get to see those horrific conditions that we got to see during during the pandemic, or even now sometimes, to be honest.
Yeah. So one of the things that you mentioned was these standards, and I just want to be very clear, so our listeners have a really good understanding of what they look like and what they are. So previously, like we have all these different provinces. So you did mention a national standard. Is this something that from a federal perspective is across the board that all provinces now must follow, or is it something a little bit different?
So these are standards. I call them Canadian standards because it truly reflects the voices of people that want to make sure that change is made. And both CSA and HSO worked extremely hard. And actually, Health Canada actually gave them funding to have these very extensive consultations to talk about what these standards should actually look like. And as I mentioned before, part of now my job is to make sure, and when I say it's with the Minister of Health and myself, is to not work with provinces and territories to implement and make sure those standards are enforced. So right now, currently 60% of the standards, close to 60% will already be accredited. 60% long-term care homes will already be accredited by these standards. But we need to make sure 100% of them do, right? So there's still the 40%. So now we're working with provinces and territories, negotiating with them how that may look like. And we also put aside now $3 billion at the table to say, this is the money. Use this money to enforce this. But this is what Canadians want, and they really should reflect what the realities of long-term care homes should look like in this country. So we're working really hard to make sure they enforce these standards. And I can assure you, and I think that's a nurse in me, we're going to make that happen.
Yeah, I think the biggest piece and the biggest fear surrounding this whole thing was that accountability piece, right? I think that's Absolutely. One of the things that we continue to like push and ask for, is to ensure that, if we do have standards, and I think because you're a nurse as well, that, like for example, hospitals have an accreditation process. And if their hospitals aren't accredited, they don't meet the standards, and they're not meeting the standards of care. And I think that's something that a lot of us were really concerned about in long-term care. So I'm actually really, really glad to hear that there's going to be some standards, some national standards that will be looked at in terms of making sure that there is accountability in relation to the care. And I think the other piece that I was kind of thinking about too, as we were talking, is really looking at those nursing ratios. I don't know if there's anything that has been discussed with your office. I remember actually working in long-term care myself. I did a very short stint there, not just saying it wasn't for me, but I think at the time I was there were those challenges, those same challenges that we discussed just earlier in the episode. And one of the things is nursing standards. And I hope I'm not jumping the gun here. Did I jump the gun here?
You know what? I actually just wanted to pipe in and say that I think a lot of the public's trust in long-term care has been eroded. So I think these standards will really bring back some trust, right?
Absolutely.
And I think that's really important because a lot of people feel like, even a lot of elderly, right? They feel like going to a nursing home is like a death sentence. And we don't want people to feel like that. And with everyone, with the general population aging, this is not something that we want people to feel. So I do feel like the standards are a big step in the right direction. I also think that, there are many concerns about oversight in addition to the standards, access to treatment, and of course the biggest issue is ALC beds. Do you feel like there are policies that discriminate against seniors when it comes to these aspects?
Well, that's a really good question. And I think one of the things that, again, when I think back to when I first joined politics and I said, you know what, I'm going to change the status quo and I'm going to change all these things. But also one of the things that I think I learned really early on is when it comes to healthcare, right? Like it is a shared responsibility. And I hope a lot of people, and I do a lot of education in that front as well, because everyone sometimes seems to think that, okay, the federal government will impose this and the provinces get it. Like that's just not how it works, right? Like we actually have a shared responsibility when it comes to the federation that we have. So as a federal government, we have funding models, we have standards that we set, and these are things that and making sure that that standard is kind of nationally looking at what that may look like. But that the provinces also have a huge responsibility because they are the jurisdiction that actually delivers the care, right? And those conversations are very interesting always. I can tell you some of the health accord discussions that we were just having earlier this year. The fact that, we put forward close to $200 billion in healthcare agreements. But we said, and this is why it's so important, because I think you hit a very important note, but it's making sure that money is not just going to the provinces to say, you know what, do whatever you want with it. But it's making sure there's specific outcomes attached to them. And I can tell you this has been always a point of the reality is, provinces will say, well, we know best how to run our jurisdiction of the needs of our community and the needs of our province, right? So give us the money. And we've done that in the past and we've realized that does not work. I remember when back in 2017, when I was parliamentary secretary to the Minister of Health at the time, we put aside billions of dollars into home care funding, right? For provinces and territories. And reality is now I get to see that even as a Minister of Seniors, like, I don't know where that money is. And I don't know how that money was actually, and these are questions that seniors ask me myself. Like, there was this announcement of billions of dollars. Where is that money? But it's about making sure those outcomes are there. So now when we negotiated with provinces and territories, and this was actually earlier in February when the Prime Minister met with all the premiers and we put aside $200 billion of funding agreements, it was to make sure there's 4 big priorities that we talk about. So first is around making sure, when you talk about family health teams, right? The fact that people don't have access to family care doctors or nurse practitioners or others at the community, right? Like, where do people end up if they don't have that support at the community level? They end up in hospitals. Like, we need to change the narrative and making sure that we're thinking of having and making sure that people need to have family care health teams, family care doctors, nurse practitioners at the forefront. Second is around supporting our healthcare workforce, right? Like, we've seen challenges in recruitment, we've seen challenges in retention, we've seen challenges in making sure that there's mental health supports for our healthcare workforces. And that also means, better wage up top-ups for nurses, for PSWs and others that work in these professions. So there's that is like the second big bucket that we have that we want to make sure we want to see outcomes, we want to see results. The third is around mental health and making sure that mental health piece is actually integrated in primary care, right? Like, you can't can't have the same revolving door issue when it comes to, something extreme happens to an individual and they're out in the community with no supports again. So making sure that's integrated with primary care. And third piece is around data. And this is a big piece because we do a really bad, when I say we, like in Canada, like we do a really bad job at collecting data. And we can't just be, talking about, we need help in this part and this part and this part, unless we actually have data to look at. And we've now have asked, and the Prime Minister is very big on this, because he's like, we need to make sure where there's needs, what's working, what's not working. The reality is we don't even know how many PSWs exist in Canada. Like that is when I talk about data, like we need to make sure we're really looking at that piece. And when I say this, so we're very clear with provinces and territories. These are the outcomes that we want, and these outcomes now the provinces are working. My colleague, the Minister of Health, is talking to provinces and territories, negotiating, and said provinces need to come up with an action plan to say how you will actually reach X, Y, Z goals that we talked about, and not just the fact that when you talk about accountability, and it's not accountability to the federal government, it's accountability to Canadians, and that data needs to be public, because that is key in making good policies and good decisions. So when we talk about some of the challenges, and I remember one of the things that I always think about is it's kind of showcasing to Canadians how different levels of governments work, and why we also need to make sure we're advocating for the right things with the right governments, because the reality is we all know the issues, but we need to make sure that we're pulling those levers where those issues and outcomes that we need to see. So I don't know if I answered your question. I don't know where we're going with this, to be honest, but I kind of wanted to take it back, because I think just being inside the government, I think sometimes on the outside, you don't really see how it all kind of works out and it plays out. But I think the more and more I talk to, particularly like the new nurses students and new graduates and young people, to say use your voice at every level, because even at municipal levels, even at within your hospital management level, like use your voices at every level, because it truly does have an impact. So I'll leave it there. I don't know. I don't know if I answered your question or what the question was, to be honest, but I wanted to talk a little bit about the jurisdictional challenges that I think we have in the federation that we are in Canada.
Yeah, no, I think you touched on a lot of good points. I do want to circle back to one thing, because I think the other thing that Canadians really want is fiscal responsibility. You talked about sometimes not even knowing where like the money goes. And I think that there's a lot of conversation concerning, particularly here in Ontario, with, public versus privatized forms of healthcare, and particularly in long-term care. We know that some of these facilities are owned privately. And it's like, how do we get this? I guess the question that I'm asking, it goes back to, the budget, saying that there might be some strings attached. So are there any strings attached that we know about from a federal perspective that will, again, I think the word is like protect actual seniors from, some of these things, whether it's, like I was kind of mentioning, and I kind of was going a round way about it, but like, nursing staffing ratios, seeing that in long-term care, the ratios can be kind of out of control, like one RN to like 32 residents, or even looking at things like meals. I think one of the things that I heard over the long, from various other healthcare advocates, long-term care advocates, that some folks aren't even being fed really great meals, or, certain things like that. So how do we, again, ensure that, we are doing our due diligence and best to protect seniors from that federal perspective? Are there more strings that are attached to the finances that we send to the provinces?
Absolutely. And I think that is exactly what the conversation has been for the last a number of months, particularly, I say post-pandemic, and I feel like we're never really out of it. But talking about Canadians need to see outcomes, right? So we can't be pouring money into a system sometimes that, quite honestly, has not been living up to the expectation that we as Canadians are so proud of, right? Because, you think of Canada and you think of a publicly funded healthcare system, and that is at the core, I can assure you, at least from the federal government's perspective. And the Prime Minister has been extremely clear to the premiers. We are proud of our publicly funded universal healthcare system, and you should be receiving and always getting healthcare based on your ability, to access healthcare, on your ability to actually, you just need your healthcare. You just need your health card to actually need healthcare, not your credit card. And I think he's been very clear on that front. And as a federal government, we've also, sometimes taken money back, from provinces that have not been kind of living up to that a level of expectation that Canadians have. And so when we talk about these expectations, and this is a conversation that's exactly what we've been having with provinces, and it's not, again, accountability to the federal government, so then you will get the money, but it is accountability to Canadians. So, making sure we, reduce those backlogs that we've seen after the pandemic, making sure, our emergency, the surgical backlogs that we've seen, like, the provinces need to show us how the money was actually spent, and that money and those action plans and those indicators need to be public to Canadians. So, and we can only know that once we have the data, right? So that is why those pillars and those indicators are so important in having that conversation. When you talk about the nursing ratios and particularly long-term care homes, and you hit the nail, like, you're absolutely right. And that is why, when you talk about the standards that HSO and CSA talked about, I always talk about HSO and CSA as, two things, as Dr. Sinha, as always explains to me. It's one is a hardware and the other one is a software. So the hardware piece is like the CSA piece, which is how should a facility look like, right? Like, because we've saw, unfortunately during the pandemic, we just didn't have the infrastructure in place to actually separate COVID from non-COVID patients at the time. And that kind of, exacerbated the realities at that time. And the software piece is exactly what you talked about, the nursing ratios, the PSW ratios, and some of those work conditions for them, and making sure that they're supported in that way, right? So that's what those standards are all about. And they really do need to, and they really reflect what Canadians have been asking for, because of the extensive consultations that both the groups did in actually coming up with these standards. So yes, and we've told provinces and territories now that we're having conversation with them, there's money at the table. And this is not the end also. So there's money at the table for them to actually implement these standards in their provinces and territories. But this is also not the end. We've also will be working hopefully in the very near future, coming up with our Safe Long-Term Care Act. So all these things and pillars are going towards exactly what you talked about. It is about making sure it shouldn't matter where seniors are living in this country. They should receive the same standard of care. So it doesn't matter if they're in Newfoundland and Labrador or they're here in Ontario, that level of care should be at par in Canada. So we're using every lever possible, I can tell you, and making sure that is at the core of everything that we do, and that it's rooted in dignity and respect. Because fundamentally, what we've seen, and and I always say this, like, people do have short-term memories, right? Like, it's one issue after the next, and what's next. My job is to make sure we bring these issues always at the forefront. And I can tell you, I do that in every meeting that I am in, when I'm at the cabinet table, when I'm in meeting with our federal, provincial, territorial ministers meeting, which we just had for seniors 3 weeks ago here in Toronto, when I had an opportunity to talk to every single seniors ministers in Canada, talked about why this matters. And there's some really interesting, good work happening in different provinces and territories that I think we all need to learn from as well. But fundamentally, it's about making sure that we're serving Canadians, and in my role, particularly as a Minister of Seniors, supporting them in ways that they deserve, because they built this country, and we need to make sure that they're supported.
Absolutely. And I like what you said, short-term memory about long-term care. I think that's really the gist of it. And I feel like a lot of this public, interest in long-term care and seniors really came about as a result of COVID. And as we kind of said, it's winding down, whatever that means. But I'm just wondering, from your perspective, do you think that COVID is still an issue in seniors' health? And if not, what is the most pressing issue right now?
I mean, I could tell you, and I spent a lot of time talking to seniors from coast to coast to coast. And there's three big, when I talk about seniors issue, I put them in three big buckets, right? Like, one of the fundamental things and as part of my job also, is making sure there's financial security for them, and that how do we strengthen that financial security? And we have a number of things that we're doing as a federal government on that front. The second piece is around aging at home. I mean, by 2051, a quarter of the population population is going to be 65 plus. And, we can build as many hospitals or long-term care homes that we want. But the reality is, hey, you talk to seniors, you tell them where they want to live. They want to live in their own homes that they built in the communities that they built them, in, right? And if you ask me, when I'm, I don't know, 85, where I want to end up in, I want to be in my own home. And, I think we all want to age in our own community. So that's the second big pillar that I work on. And the third is a long-term care piece, which is making sure there is a time when you cannot live in your own home and making sure that those supports are out there. So when I talk about aging at home and home care and what that looks like. So again, the federal government has different things that we work on. So delivery of care, we have to give provinces the tools to do that. So the billions of dollars with the now that we're negotiating with them, $8 billion on home care that we're giving to provinces and territories. We also have different tools. So we have this initiative called New Horizons for Seniors program, it actually funds close to 3,000 organizations across Canada every single year. And seniors love this program because they get to do different exciting things in their own communities. And one of the things, when you ask me what is some of the most what I hear from them is social isolation, right? Like COVID has been challenging for everyone, but the group that has impacted the most is seniors. And of course, we saw the tragedies in long-term care homes, but there's also, the silent kind of pandemic that was happening was around mental health. And particularly when it came to seniors was around social isolation. And so the program, the New Horizons for Seniors program, is designed to kind of strengthen those senior serving organizations that provide that support, right? So I met a lady, I think it was just 2 weeks ago, and, I was telling her and she was telling me how this program really impacted her life, right? So she, through this program, had a mentor or mentee. I can't really say because it was an intergenerational program. So she had a young girl who was supporting her, but in the other way, the young girl said that I was learning so much from the senior, right? So there was an intergenerational program where a young individual was teaching seniors how to use technology and so then she can stay in touch with her family. But now the senior said that she was so empowered by the technology that she's actually able to have, set up her, she says she's able to set up her doctor visits and other things just virtually. Like, I was like, how is it that you're doing that? And she was 85 years old. First it started off just as a way to just keep in touch with her family to make sure she's still engaged. And now she's actually using this to for her own health. And she said, I Uber Eats stuff all the time, so I'm able to get the support that I need. And I was like, this is such a way, what a neat way to actually empower seniors, right? So I'm just giving you one little example of what 3,000 organizations do across this country to actually provide that support. We also have another program that we just put forward, which is an Age Well at Home initiative. And this is, again, around strengthening senior serving organizations that can help seniors stay in their own homes for as long as they need. I spoke to a senior, and it was in Quebec, and I said, what is your biggest anxiety? Like, what is the biggest issue that you have? And he said, my biggest issue, and he was in this northern part of Quebec, and said, my biggest issue is that I wish someone could come and shovel my snow. Like, that is his biggest anxiety that actually prevents him from, thinking, okay, maybe I can't live on my own. Or I hear that I wish someone can just drop off a good, healthy, nutritious meal for me, or that someone can pick up my prescription medications, right? So this is a program that we put forward that actually strengthens and senior serving organizations on the ground to be able to give seniors those tools to be able to stay in their communities longer. And one of the other things that we're doing is I have the National Seniors Council, which has members from seniors themselves, but also experts on seniors care and others that serve both myself and the Minister of Health. And we have now tasked them to look at what an aging at home benefit could look like. So there are different things that we're doing to support seniors stay in their own communities for as long as they can. And because seniors want to age at home and they want to be in their communities.
Yeah, that sounds like a lot of really great work that's been happening. And I think that, again, really increasing that access and also, of course, awareness of these programs will be very, very beneficial for seniors all across Canada. I think we have 2 more questions, so we're going to make sure that we get them in. We have a little bit of time left. What do you think Canadians need to be aware of as we continue to age? And the other piece is just even thinking about how we can continue to be a part of the solution as, nurses, as folks that are interested in healthcare. What are the things that we need to know about so we can be aware to continue to advocate for them?
I think that's a really important question, and I think I'll start with what I mentioned earlier on, which was around nurses, particularly, being the largest workforce in Canada. Like, I can't understate like how much our voices matter, and when we talk, people listen, and I do mean that. And I always think of when we're taught to be advocates for our patients, I always think back to being a new nurse, being in I was mentioning in an oncology unit, trying to deciding should I call at 3 a.m. in the morning, like the physician on call, or should I not? Like, is this urgent enough? And the answer is always just do it, right? Like, always be the advocate for your patients at that front. And as a nurses, your voices matters. They matter so much on every level. When you talk about it in settings such as within the institutions that you work in, they matter when you're in talking about and advocating for things that matter to you. Like, that's why, I have a really good relationship with nursing unions and CNA and others, because they really do amplify those voices. And any opportunity that you can get involved. Like, get involved with your local organizations on the ground. I mean, look at you guys. I mean, you guys, and I would love to maybe at some point have just this conversation around, like, you're amplifying those voices. You're talking about issues that matter to Canadians and to healthcare. And that takes courage too, right? Like, that takes a lot of courage to do what you do. But I'm not surprised, because you're two amazing nurses that do this. But I think it's about every opportunity that you can get to get involved, because when nurses talk, people listen. And I think when we put our heads together, as I mentioned, being like the largest workforce in our healthcare, what we say matters. Like, it really does. So get involved in any way that you can. Write to your local politicians of different parties, get involved with different parties, because it's so, and you probably talk, and you probably heard this, when people talk about, oh, politics isn't for me. Well, everything that we do is politics.
100%.
Everything,
Yep.
from your from getting your lawn cut to getting your garbage removal sort of things, getting, at the municipal level, your roads, the infrastructure, your healthcare, your education, everything is politics. And I think it's so important to get involved, to use your democratic right to vote for at different levels, because we are the change that we want to see. Like, we really are. And until we get involved and use our voices to talk about things that matter to us, I mean, no one else would listen then, right? Like, so I think that's fundamentally extremely important for me. And I do share this with, particularly at all the colleges and universities that I visit nurses on, because this is a workforce, like, we're everywhere. We're literally everywhere. And the experiences that we bring to the table, no one else can. And I can tell you, sitting at a cabinet table when policies are made, and I just look at people and say, no, that's not how it's going to work in the reality in a healthcare workforce, right? Like, what we say and I think the experiences that we bring is so valuable that I think it matters. It matters on every board. It matters at every level, government. So get involved as well. What I'll kind of leave you with in the end.
Absolutely. And I think that when I think of, one voice actually does make a big difference. You're a perfect example of that. Our podcast is a perfect example of that, using advocacy, tying healthcare and politics together. I think these are all really great things. And I really wanted to thank you for being so inspirational today in your message. And I certainly learned a lot. I know Amie did as well. Is there anything else that you wanted to share before we wrap up for today?
Well, I'll just say, look, continue doing what you're doing, because the conversations that you're having are so important. They're so instrumental in kind of fixing the damage that's this pandemic caused, but also preparing our healthcare for the future. And I think educating people about what different levels of governments do, educating people how they can, use their voices to be talking about things that matter to them, issues. And, I was just briefly looking at all the issues that you guys talk about. I mean, you guys talk about everything and anything, which is so important. I think those things matter. And I would love to perhaps, come on at any other time and we can talk about something else, a particular one topic if you guys want to talk about. But I think just use your voice, and to the both of you, really thank you for all that you do. I know you're both active nurses as well, and you do this and so many other things in between. And it takes a lot of time and it takes a lot of courage, and I can tell you, to be two strong women to be doing what you do. So thank you so much for having me, and I'd love to come back and chat some more when we get an opportunity to do so.
Absolutely. You touched on that you do some work in sexual reproductive. So definitely we'll have to have you talking about that, because that's such a hot topic in Canada, in the US, all around the world. But again, yes, thank you, Honourable Kamal, for coming on and talking to us at the Gritty Nurse podcast.
Absolutely. And for all of you listeners, thank you for tuning into the Gritty Nurse podcast. If you're watching on YouTube or you're listening to one of our podcast platforms, make sure that you subscribe, like, and leave us a review.
Thank you so much for listening and coming on.